Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Noha. I am Gynae specialist at Rustaq Polyclinic. In the beginning, I would like to thank everyone who attended the lecture today, and a special thanks to Dr. Ruqayyah for sharing her valuable experience with us. This is recording of the lecture for those who couldn't attend. Our lecture was about skincare in pregnancy and the safe medication that can be used in pregnancy. As you see here, there are different forms of skin lesion, either as bullae or eczema or psoriasis or petechia or lignification or petechia or purpura or vesicle or papule. Sometimes when we get a patient with a skin lesion, it's better to describe it as it is. For example, if we see this form, we can say this is a bullae, which is circumscribed elevation of epiderm containing a serous fluid. And if it is larger than 5 millim, if less than 5 millim, it will be vesicle. The same for petechia, which is less than 5 millim, but if it becomes larger than 5 millim, it will be called purpura or ecchymosis. And also you can see here papule, which is less than 5 millim. If larger than 5 millim, it will be a nodule. Again, we can see here, this is skin discoloration. It's called macule. This is sign of secrushing. And this is linea nigra. It's normal happen in pregnancy. As you see, the color is dark. It will turn to linea alba to be like pink or white after delivery. And this is around the nipple. It's called Montgomery tubercle. These are considered as normal physiology in pregnancy. So if we got patient, she will ask, what is this? Of course, we'll tell her this is normal due to physiological changes in pregnancy. And the same this for Montgomery tubercle, which is hypertrophy or sebaceous gland. So there are many problems in pregnancy. Some are considered as physiological. What are the physiological? Sometimes pigmentation. Many pregnant women, they have skin discoloration on the face called chloasma and may persist after delivery called melasma. Sometimes she will suffer from hirsutism or alopecia. Sometimes the nail will be hyperkeratosis or ankylosis. And the gland, sometimes there is increased function of exocrine and sebaceous gland. In addition, sometimes there is erythema palmaris, edema, which are non-bleeding edema, varicose vein, and hemorrhoid. These are all considered as common problem in pregnancy, which are physiological changes in pregnancy to the skin. So up to 90% of women experience an increase in pigmentation during pregnancy. As I say, linea nigra, linea alba, linea nigra in pregnancy after delivery called linea alba. If it is persist, sometimes there is melasma in the face, sometimes stria gravitera, acne vulgaris, Montgomery, all these considered as normal physiological changes of skin in the pregnancy. So the question will arise, many of the female patients complain about acne, unwanted hair growth, and other skin problems that have only developed since they became pregnant. Are products used for these types of benign skin condition safe to use in pregnancy? As it is understandable that women want to look their best and this important time in their life. So the answer, most of the cream are safe, exception hydroquinone and tretinoin, which are better to be avoided in pregnancy because of their absorption. In addition to the one type of high potent steroid, I will mention it later. Otherwise, most of the cream considered safe in the pregnancy. So Again, hirsutism, thick hair, nail may become brittle. This all consider physiological changes normal happen in pregnancy. After the pregnancy, you will find that many women came to us complaining of hair shedding, which usually occur 3 to 6 months postpartum. Diffuse non-scarring alopecia. That's why we always prescribe PFOL to the pregnant women during pregnancy and to continue on it after delivery. And the recovery, of course, will be happening after 9 to 12 months. So just we will reassure the women. About the eczema, as you know, here many women complain of eczema. So sometimes it's due to that they exposed to allergen. So we'll ask them to avoid allergen. And the treatment in general for any skin condition in the pregnancy, we can use emollient, which are safe, and we have KY gel here in our clinic. Anyone can come and take for any patient. Corticosteroid can be used for acute exacerbation, and it is the study found it is safe, and many infertility clinic they are using steroid during fertility treatment, and they continue on it. But we have to put in mind that in first trimester there is small risk of cleft lip. But the study is small. In addition to increased risk of diabetic and elevated blood pressure. So if you want to give steroid to any woman with diabetic, it's better to be admitted to the hospital for glycemic control because of the risk of increase of glucose due to steroid. What about oral antihistamine? You can prescribe oral antihistamine all the time, or whether allergen, which is chloramphenicol maleate 4 milligram, or loratadine, or claritine, except activate is preferred not to be used in pregnancy. So emollient, oral antihistamine, and you can use also hydrocortisone 1% cream. Also, the eczema is likely to get worse in pregnancy, so emollient are the first line of treatment and considered safe in pregnancy. Topical tacrolimus, which is of course to prescribed by dermatologist. Phototherapy with UVA or UVB are considered also normal, but BUV, which is Zoraline UVA, consider risk and better to be avoided in pregnancy. Beta-rhodogenic, cyclosporine, and azathioprine are preferred agents should be systemic treatment be required in pregnancy, while short course of prednisolone are also considered to be safe. Against the psoriasis, there are different type of psoriasis, but psoriasis is to be treated, of course, by dermatologist, but till she will get the appointment, we can give her the same measurement that we can give her emollient and give her hydrocortisone cream 1%, and also you can give her sometime, if you need, corticosteroid. And also Coulter considered safe. Again, Buva is contraindicated in pregnancy. Biologic agent, sometimes anything with ending with MAB, adalimumab, something, it's better to be discontinued in the third trimester because it can affect on the baby and it is not easy, it will be difficult to give them vaccine. What about the acne? Acne is, as we say, will increase in pregnancy. But what are the medications that can be used in pregnancy? Erythromycin, clindamycin, benzoyl peroxide are safe. Of course, oral tetracycline will not be given, and retinoid absolutely contraindicated. And if the woman was on retinoid and conceived within 1 month, it is better for termination of their pregnancy. But if after 1 month, there is no issue. So always the study found that if the woman taking retinoid and she stopped it and conceived after 1 month, there is no risk. But within 1 month, it's better to refer her for a normal scan because there is risk of teratogenic effect on the fetus. So again, we can use topical benzoyl peroxide, topical antibiotic like clindamycin and erythromycin, salicylic acid. It's best avoided in pregnancy and breastfeeding because the risk of salicylic poisoning in the fetus. But it's preferred the concentration less than 2%. If more than 2%, it's better to avoid. But if the percentage of salicylic acid less than 2% can be used. What about azelaic acid? It is safe. Topical retinoid, adabalin is topical retinoid. Transcutaneous absorption is thought to be low, but given the non-teratogenicity of systemically administered retinoid, it's best avoided. What about dermatosis of pregnancy? This is a very important subject, especially for us in gynae. If any woman came to you complaining of itching, but there's no skin lesion, and in the third trimester, refer her to the OB/GYN after doing liver function test. But if in first trimester or second trimester she has this skin lesion, so also refer to OB/GYN, but you can give her medication, the same emollient or hydrocortisone 1% or antihistamine. As you see here in the picture, this is atopic eruption. This is polymorphic eruption. And the last picture is bombivioid gestations. So what are atopic eruption? Atopic eruption, sometimes she has family history of allergy. Can happen anytime in the pregnancy, but it is benign. Just give her emollient, antipruritic, topical corticosteroid, antihistamine. What about polymorphic eruption? Polymorphic eruptions mostly happen in prima gravida, in twin, and those who are rapid weight gain. Sometimes happen in the late second trimester to immediate postpartum. Sometimes appear as papule or black dark lesion. So here the same regime of treatment: emollient, antipruritic, topical corticosteroid, antihistamine oral. Any type of antihistamine can be used, as we mentioned. Apart from Activit, is better to be avoided. What about bombivioid gestation? Bombivioid gestation, this is will appear like this. You see here, look like chicken pox. There is vesicles. In this case, this is autoimmune, and it started in very umbilicus. If you see here the picture, it starts around the umbilicus. It will be start in very umbilicus area and may spread anywhere, but spare mucosa. But also here, the same management, but we can also add azithromycin, cyclosporine, or sometimes plasmapheresis, but of course, this is the management of dermatology. But we can prescribe emollient, topical antipruritic, topical corticosteroid, or antihistamine. What about intrahepatic cholestasis? This is very important subject that any pregnant woman in third trimester complains of skin itching, annoying itching, but there is no skin lesion. Of course, we will send her for liver function test. We'll find elevated AST and ALT. Of course, this is to be referred to OB/GYN immediately because if there is elevated liver function test, this needs admission to the hospital and follow-up. So again, here, as we say, if any woman with a pruritic without rash, we will do bile acid and liver function test, but bile acid is not available, but liver function test, we will do it. If the liver function test come normal and the patient came to you after 1 week with the same symptom, repeat liver function test every week, because sometimes will not, there will be not arranged in the liver function test from first week. But if you find any dearranged liver function test, immediately to be referred to the hospital, because this is need secondary or tertiary hospital to follow up this case. Now we will speak about this common infection, fungal infection. Many cases we find they have like oral thrush or candidiasis or pityriasis versicolor or fungal nail infection. Just to mention that nystatin is safe, can be used as long as even 1 month, safe for oral thrush. Clotrimazole also can be used. Terbinafine, cephalosporin, oxygenazole, these are safe in pregnancy, because you know that fungal nail infection needs long time, so you can prescribe Dinixer, and you can refer her to the dermatologist because need long time management. For the oral thrush, we say we can give nystatin. What about vaginal candidiasis? In a pregnancy, you can give Mycoheal or clotrimazole substeroids, 500. And it's better to avoid oral. Do not give anything oral regarding fungal infection or candidiasis, like fluconazole is better. It should be avoided in pregnancy. And also voriconazole to be avoided in pregnancy. So in any woman with candidiasis, if vaginal, we can prescribe clotrimazole substeroids, which is very safe in pregnancy. And we'll speak later about vaginal discharge management in pregnancy in another lecture. What about warts during pregnancy? You know, there are different types of warts. It's caused by human papillomavirus. If it's happened in the flat wart or common wart, if it's happened in the food, it's called plantar wart. Sometimes there is genital wart. But for the genital wart, any pregnant women or any woman came to you with genital wart, please do HIV, syphilis, hepatitis B, hepatitis B, and the same for her husband, and to be also examined by male factor, because it is considered a sexual transmitted disease. And always after diagnosis of perineal or vulvar or vaginal wart, it's better to do pap smear, because there's risk of cervical cancer, especially if the human papillomavirus genotype 16, 18, 31, 33, 35. So what are the management of warts during pregnancy? Cryosurgery is the first line of management, but also sometimes surgery can be used, but podophyllene is to be avoided at all, not to use podophyllene in pregnancy. Salicylic acid, yes, sometimes can be used, but not for genital warts, and it's better to be used in a small area, limited amount of time. What about cryotherapy? Is the safe and is the first line of management, as we mentioned. What about surgery? We can use it, but sometimes we do scarring. What about laser? It's safe. So warts treated during pregnancy, the first line is cryotherapy, laser therapy, imiquimod. All this can be used in any time, any trimester in pregnancy. But again, should be referred to the dermatology and to the obstetrician, because this patient needs to be followed up, because there are some kind of warts due to human papillomavirus 16 or 18 lead to cervical cancer. So to follow up for pap smear, if it's come negative, that's all. So again, here we say Quinone is better to be avoided. Azelaic acid can be used. For the acne, we say topical retinoid is better to be avoided. Erythromycin, clindamycin can be used. What about benzyl? Benzoyl peroxide is better to be less than 5%. Sometimes we have to look to the percentage, how much the percentage less than 5% can be used. Glycolic acid can be used. Anti-aging. Many women are taking care of their skin. They're using vitamin C, vitamin E. These are all like anti-aging. These are considered safe. Resveratrol, which is like antioxidant, also considered safe. What about management of Citria gravidarum or Citria schmark? They can use laser therapy or carboxytherapy, emollient cream. They are all considered safe. Also, hyaluronic acid considered safe. Vitamin E, glycol, glycerin, all are considered safe. For the nail and hair concern, many women, they have like hair fall, minoxidil not to be given, used for hair fall. Hair dye is better to be avoided in first trimester, but can be used in second and third trimester, and they prefer to use non-ammonia type of dye. What about henna? Let's say. What about hair straightener? It is can be used, no harm to the mother or fetus. What about nail polish? They say it's better to be avoided, especially if contain phthalates. But if she asking you which nail polish she wants to be used, you can advise her for one type, which is called either 3 or 5 or 10 free polish. What about insect repellent? It is considered safe. For varicose vein, we can use elastic compression stocking. What about muscle spasm? Yes, we can use Move or Vicks are safe in pregnancy. And here are the medication that we have in our pharmacy. The betamethasone, even though it's C, but can be used in pregnancy. This is can be sometimes we start with hydrocortisone 1%. If no benefit, we can increase to this type of steroid cream. What about betamethasone scalp application? Also, we say it's safe. Clindamycin, ceritimide, these are all safe. And as we say here, betamethasone salicylic acid. We say salicylic acid is better to be used on specific area of the skin on short period. Clotrimazole cream is safe. And if salicylic acid with lactic acid, it is safe. If salicylic acid percentage less than 2%. This is clobetazole propionate. This is used for lichen sclerosis in older women. Many women complain of severe vulval itching that does not respond to hydrocortisone 1%, neither to betamethasone. So we give clobetazole propionate, which is high potent steroid, better to be avoided in pregnancy. What about silver? Silverizine cream, safe. Permethrin cream, safe. Hydrocortisone cream, we say safe. Antifungal with steroid cream are safe. Mupirocin, nystatin are safe. Lupnocaine gel, sometimes if the patient, for example, has episiotomy, pain at the site of episiotomy, you can prescribe for her lupnocaine gel. It is safe. Sometimes if there is any, also like anesthesia, analgesia, local analgesia, anesthesia can be used. It's gel any injury anywhere. It's safe. Mometazone can be used for a short period. Fusidic, of course, it is safe. Tetracycline can be used because we say the absorption is very low. And these are the same as we say calamine lotion. Sometimes we are giving for some women with chickenpox or sometimes these are obstetric cholestasis. Can we give them calamine lotion? It is safe. Anti-hemorrhoic cream or ointment or are safe. Tretinoin, it is, as we say, never to be given because of teratogenic effect. And hydroquinone also we say not to be given. What about chlorhexidiniumycin cream? Also can be used and considered safe. So again, these are just another references about the medication that can be used in a skin condition in a pregnancy. Already we mentioned it before, just if you wanted just for your further references. And these are the references that I used for my lecture. Thank you very much for your listening. If you have any question, feel free to ask anytime. Thank you very much.